Hello, hope you're doing good. So today's questions are, what does it mean to keep the rib cage down and back and make the C curve, as well as major muscles of the lower extremity? So what does it mean to keep the rib cage down and back to make the C curve? When trying to stabilize the trunk, a common mistake is to contract the spinal extensors so the rib cage juts forward, and this could be rib leading. The upper attachment of the abdominals onto the rib cage can pull the front of the rib cage slightly down and back to prevent this undesired rib leading and hold the rib cage in its desired neutral alignment in many exercises. In other exercises involving spinal flexion, pulling the front of the lower rib cage down and back can aid in getting the desired maximum spinal flexion to help with achieving a full C curve. In order to make a C curve, a common error when flexing the spine is to flex only the neck and the upper thoracic spine while leaving the rest of the spine flat or hyperextended. Another frequent problem is to have most of the curve occur in the thoracic spine, a region of the spine that is naturally concave to the front but is already excessively rounded, in static alignment in many people. Instead, the intent of this cue is to include flexion of the lumbar spine, a region naturally concave to the back and often tight, making flexion in this area is more challenging. This will aid with distributing the forward curvature as much as possible throughout the spine while pulling the abdominal wall so the head, spine, and pelvis form a C shape that is concave to the front. And then some of the major lower extremity joint movements and muscle could include, in hip flexion we have iliopsoas and rectus femoris. In hip extension we have gluteus maximus and the hamstrings, which include semitendinosus, semimembranosus, and the biceps femoris, short head and long head. In knee extension we have the quadriceps femoris, and this includes rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. And for ankle, foot, plantar flexion, we have gastrocnemius and soleus. Thank you.